Let's talk a little bit about regenerative medicine and how it can help with joint pain. Joint pain afflicts, some of the numbers say 23, 24, 25, 26% of Americans, women more than men, and it can cause things like sleep and mood problems, pain, and lack of function or decreased function, and then absenteeism from work too, right? Joint pain is a big deal, and surgery and steroids and pain relievers just can't possibly be the only options that we have, right? There's got to be a better way. I'm going to talk to you about that better way. I'm Joy Vanderlaan. I'm a functional medicine and regenerative medicine nurse practitioner, and I help treat these patients every day, and I just take such joy in seeing people not only improve physical symptoms, but also the quality of their lives improves so much when we treat them as an individual and give them these regenerative options. So what things can cause joint pain? Why would somebody have joint pain? Well, if you're listening to this video, you probably have joint pain, and you know at least one of them because you're experiencing it. But things like osteoarthritis or rheumatoid arthritis, which is an autoimmune condition, or just injuries. You've played sports, soccer, or you're a runner or football, and you've had an injury, or other just degeneration over time, overuse injuries like tendinitises even, and a lot of osteoarthritis is an overuse injury. So lots of different reasons why people may have degenerated or painful joints. And the typical treatments for this include steroid injections, which are a Band-Aid solution. They don't cause any healing. They can be helpful, but over time with multiple injections or steroid doses, tissue degeneration actually is the result, which then can lead to surgery. And that's another option for a lot of times for osteoarthritis, for a lot of these reasons why somebody may have joint pain is surgery. And that has risks, right? The anesthesia, the cutting open of your body, potentially introducing bacteria, and the risk that maybe it doesn't help or maybe it even makes things worse. So as somebody who practices functional medicine, I have a great deal of faith in the body and the way we were created that we can heal. If we give the body the right things it needs and takes away the things that it doesn't need, our bodies really are miraculously made and they can regenerate. So to touch on this a little bit more, what is regenerative medicine? Well, it is what it sounds like. We want to provide therapies that can help the body more powerfully create healing, to heal its own tissues, to avoid medications and surgeries and steroid injections. So what are some regenerative therapy examples? Well, stem cells, as we know them, are one option. And whether it's Wharton's jelly, so cushioning in a joint that also has a lot of signaling molecules in there that are going to signal the body to send stem cells, send healing factors, and really modulate the immune system and the inflammatory condition there to promote the best environment for healing, and to tell the body, hey, send stem cells over to that elbow. When we inject Wharton's jelly into an elbow, for example, then all the body's healing power can be more focused on that elbow to heal and regenerate the tissues. And those stem cells then that our body sends there does that regeneration. It's amazing. And then PRP is another option for regenerative therapy. That treatment comes from the blood of yourself, of the patient, and we draw 1 or maybe 2 vials of blood, and we can spin it down and use just a certain part of it, the platelet-rich plasma, and inject that back into a joint or around a tendon or into an area of inflammation or an area that needs healing and regeneration. And again, that signals a little bit of an inflammatory response, and inflammation is actually a good thing as long as it doesn't go on for too long or it's not too intensive an inflammation. Inflammation is actually part of our healing process. And so it stimulates a little bit of inflammation and uses all sorts of signals, complicated signals in the body to call healing factors to regenerate and heal the tissue and get rid of your pain and promote your better functioning. Peptides are another regenerative therapy. There are certain peptides that we know target inflammation and regeneration and tissue healing. One of the most common ones is BPC-157, but there are others. And depending on the patient and the case, we can actually even combine stem cell therapy with PRP or peptides with with stem cell injections. So depending on the particular case and even the budget and the kind of time frame that we are aiming for healing, we can really individualize treatment to each patient's unique situation. So some advantages of regenerative medicine are really they're minimally invasive. It is a needle, the size of a needle used to give, a flu vaccine, for example. I'd much rather give regenerative injections than flu vaccines any day of the week. I think they're so much better. But it's a very small needle. We use ultrasound guidance for most of our injections, and so they're very safe, and we know exactly where we're injecting that product to make sure we're injecting it into the most effective place where you get the best healing. And then we can also avoid surgery a lot of times using these therapies because we can get the body to do its job and heal itself. And we don't need surgery. Oftentimes people have avoided knee replacements or shoulder surgeries, labral repairs, rotator cuff repairs, because we've been able to get the body to regenerate and heal itself. And then also with regenerative medicine, we're really acting on curing the root cause of somebody's pain or lack of ability to function. When we heal the tissues, you no longer need the opioids because you're not in pain anymore because those tissues are normal and healed again. So it can eliminate the need for not only surgery, but can eliminate the need for long-term use of pain medications, which is really important. Not all patients are good candidates for stem cell or regenerative therapies. If you smoke, you're not going to have as good of results. If you drink a whole lot of alcohol, same. If you're eating a bunch of processed and junk foods, you're not going to get as good of results. You may get some results. So we want to pick patients really carefully, and I always want to pick the patients who are going to do best. It feels so much better for me when I'm successful as a provider as well. Sure, we could inject anybody very, very safely. Most people very, very safely, but I want to see people get better. And if they're going to pay for this, which this is an out-of-pocket expense, I want to have the greatest. I want to have the greatest chance of success because I love being effective and seeing people get better. We also want to make sure that a patient doesn't have current blood cancer or any other kind of solid cancers in the body when we do stem cell therapy, because it is a theoretical risk that can cause some problems. There's lots of potential here. If you're in pain and you're thinking about surgery or you've been getting cortisone injections, this really could be a viable alternative and really probably an overall solution to some of the pain or inability to function that you're having. So I would really encourage you to look into this and find somebody in your area or fly to somebody who you know who does this and who you can trust and have a consult with them. We do actually free 15-minute discovery phone calls, in part because I want people to be comfortable with me or whoever in Nourish House Calls is doing their injections. Usually it's going to be me at this point. But we want that sense of comfort and trust because that's really important in a healthcare relationship to know that the person who is giving you the treatment cares about you and is knowledgeable and experienced in this. So, as I said, we would love to talk to you. If you'd like to book a free discovery call and find out more and find out maybe if you're a candidate for this type of therapy, we'd love to chat. You can book a discovery call below, either below here on the link or also it's on our website too. You can find the link to book.